Hello my dear students, I am Dr. Vaishaly Bharambe. I have been teaching anatomy for the last 25 years and more, and I still love it. This is the beginning of my central nervous system series. So how are we going to cover the spinal cord? Okay, there are going to be 6 lectures or maybe even more, through which I am going to do my best to make you understand the spinal cord. Remember one thing, students, anybody who knows his or her spinal cord well will only understand the rest of the central nervous system. What are we going to do today? We are going to talk about spinal cord as an introduction. What is it? Where is it? What are the external features of it? What are its external connections? And so on. We'll just briefly touch on the lumbar puncture as well. Then we'll move on to spinal cord 2, 3, 4, 5, 6, when we will be covering internal structure, the ascending tracts, descending tracts, spinal cord lesions, and so on. So it's going to be a long series of lectures, and I'm hoping that it's going to benefit you not only because you should know it in anatomy and physiology, but you should also know it because you're going to discuss lesions in your senior years. So this is your foundation building series of lectures, right? So can we begin? Okay. First, some basics. Your central nervous system consists of the dilated proximal portion, the brain, the narrow tubular portion, the spinal cord, which is our topic for today. It also consists of an autonomic nervous system made up of sympathetics and parasympathetics. It also consists of peripheral nervous system consisting of 12 cranial nerves and 31 spinal nerves. All this encompasses the nervous system, out of which we are discussing the spinal cord today. So spinal cord part 1, let's start. First, what is it? Where is it? It's the narrow tubular portion of the central nervous system lying within the vertebral column. Take a look. Okay. It measures about 45 centimeter in the male and 42 centimeter in the female. Question, ma'am, should we remember all this? I'll leave it to you, but I'll tell you why you should know this. Right. So 45 centimeter in the male and 42 centimeter in the female, lying in the vertebral column, which is 70 and 60 centimeter respectively. Now do you understand what I'm saying? That the spinal cord in the male is 45 centimeter, but the vertebral column is 70 centimeter. So the vertebral column is longer than the spinal cord. Same is the case in case of females, where the vertebral column is 60 centimeter, but the spinal cord is 42 centimeter. A good 20 centimeters in between the two. Why is it relevant? How did this happen? We'll learn about it today. The whole spinal cord weighs barely 30 gram. Okay, so just imagine that this 30 gram structure is what decides whether you can move your upper limb, whether you can move your lower limb, whether you can feel pain, and so much more. I find this enchanting. I hope you do too. Right. So let's talk about that time when the baby was developing and when the length of the spinal cord was equal to that of the vertebral column. The spinal cord was developing and the vertebral column was developing around it. But now what happens is that vertebral column goes faster. The typical rabbit and the tortoise story. Okay, the vertebral column is the rabbit. It's going very fast, growing much faster than the spinal cord. So take a look. Can you see that here? The spinal cord is almost stopping at the level of lower border of L1 vertebra, whereas the vertebral column is extending right down till the level of coccyx. So, your spinal cord therefore extends upwards to the medulla oblongata, lower to the level of lower border of L1. The lowermost tip of your spinal cord is tapering and narrow and is called as conus medullaris. And what is the applied importance of knowing that the spinal cord ends at L1 and the vertebral column goes on till the coccyx? Why does it matter? Madam, you have said this at least 3 times in the last 2 minutes. I'll tell you why it matters. Just keep it in mind that we have to discuss this. Okay. So, ho gaya? We have done the spinal cord. We know it's lying in the vertebral column. We know it is short and vertebral column is long. Right. This spinal cord is surrounded by a lot of structures, which is very delicate, okay. So it's surrounded by a lot of protective layers, first of which is a series of coverings called meninges. I'm sure all of you know what are meninges, but let's take a little time and learn about them. This outermost thick, very durable, okay, is called as dura mater, okay. Mater means mother, protection, okay. Lying deep to that is your arachnoid mater. Looks like a spider web. See, I've drawn it also. So that's why you should remember arachnoid mater. There's a movie called Arachnophobia. Maybe you've seen it. Basically, spider web like. And inner to that is the pia mater, which is intimately attached to the spinal cord. There's no gap between them. So what are the three layers? Dura, arachnoid, pia. Clear? Dura durable, arachnoid like spider web, and innermost pia attached to spinal cord. Right. So we'll now move on to learn a little bit about each of these. Okay. There's a lot to be learned, students, but I'm going to give this to you in short capsules because sometimes spinal cord literally overwhelms you. I don't want it to overwhelm you. Take it in short capsules, learn, move on. Okay. So we're talking now about the dura mater, the durable thick pia, dura, which as you can see is dark green in this case. It's obviously not dark green in human beings. So the dura mater is surrounded by a space. So there's vertebral column and then there's dura mater, and between the vertebral column and the dura there is a space called as epidural space. Close your eyes. Imagine there is a dura mater, surrounding that is the vertebral column, and in between them there is epidural space. Every spinal nerve coming out of your spinal cord is passing through this epidural space and being distributed in the body. Why are you telling us all this, ma'am? What is the use of it? Understand that when you inject an anesthetic in that epidural space, the spinal nerves in that space become anesthetized. Can you imagine that there is a lady who is going through a rather painful process of labor or delivery? Okay, and she says, I just can't take this anymore, do something. What do? You give an epidural. You give her some relief from the excruciating pain that she is going through. This injection is called as epidural anesthesia. Where are you giving it? You are giving it in the space between the dura mater and the vertebral column, which is referred to as the epidural space. Right. So, epidural anesthesia. Let's now go to the next layer, the arachnoid mater. Again, when I say arachnoid, you should immediately at least think of a spider. Okay. So, spider web like thin layer lying deep to dura, separated from it by very little space, but lying deep to your arachnoid mater is a space called as subarachnoid space. Does it does it make you remember something? Yes. What lies in the subarachnoid space? The CSF lies, the cerebrospinal fluid lies in the subarachnoid space. Now I have a question for you. My spinal cord is ending at the level of L1. The arachnoid mater is extending down to the level of S2. Take a look. It's extending here till S2. Space deep to my arachnoid mater is called subarachnoid space. So, does your subarachnoid space stop at the level of L1 or does it continue till the level of S2? So, students, your subarachnoid space extends down till the level of S2. Spinal cord stopped at L1. CSF and the subarachnoid space continue till S2. Now, there is a huge gap between them where there is CSF. Okay? This gap between the lower border of L1 and the S2 is called as spinal cistern. Please say it once. Spinal cistern. Again, ma'am, how does it matter to us? Hoga CSF, let it lie there. How does it matter? Of course it matters, students. Come on, let's take a look. Now here you are seeing L3, L4, L5. It's a sagittal section. These are the bodies and these are the spines of vertebrae. Okay. Here you are seeing the dura mater, the arachnoid mater, and therefore deep to arachnoid, the subarachnoid space. Okay. Now you have this patient is saying, I have a severe headache, I have not been able to get rid of this, and you are suspecting that there is some kind of brain infection, meningitis, okay, or some infection for which you want CSF. You want to test the CSF for the presence of any organisms or whatever. How will you test, aspirate the CSF? Will you go in at the level of T2? Will you go in at the level of T4? What are the chances that you go in with a needle and you go through the spinal cord and permanently paralyze the patient? But you can go in below the L3, between L3 and L4 as seen in this image. When you enter in, there is no spinal cord there. Why? Because it stopped at L1, right? So there is a nice big space between L1 and S2 where there are nerves, but there is no spinal cord. So when you put in a needle, the nerves are mobile, they move away, and you are able to now begin to aspirate CSF. Okay, and now you can test the CSF, you can find out if there is infection or whatever. So let's summarize this. Lumbar puncture is this procedure wherein a needle is put in the subarachnoid space, in the space called spinal cistern, in the space between L3 and L4 vertebral spines. Let's repeat this. Lumbar puncture is a procedure by which you are aspirating CSF by putting in a needle in the subarachnoid space, in the spinal cistern, between the spines between L3 and L4 vertebra. Is that clear to all of you? Okay. Please remember this very common MCQ. Even more important is that I definitely don't want you doing a lumbar puncture above the level of L1. Okay. Right. So that's how you aspirate CSF, and that's the importance of knowing the extent of subarachnoid space, that is a space below the arachnoid mater. Right. So the next layer we look at is called as the pia mater. It's tightly attached to spinal cord. If the spinal cord has a sulcus, it goes right in, it never leaves the spinal cord. Okay. So that's the spinal cord covered by pia mater. Okay. Now as it reaches the lowermost tip of the spinal cord, if this is a spinal cord, as it reaches this tip, okay, what it does, it begins to extend down in the form of a thread-like extension, which is called as the filum terminale. What is it called? Filum terminale. As it extends down at the level of S2, the arachnoid mater is ending, correct? Now it passes through that arachnoid mater and extends further down to get attached to the coccyx. Revise this with me. This is the lower tip of spinal cord. This is the thread-like filum terminale descending down. First, inside the arachnoid mater, inside the subarachnoid space. Then piercing the arachnoid mater and extending downwards to get attached to the coccyx. So you've got two filum terminale. One which is inside subarachnoid space called filum terminale internum. One beyond it called filum terminale externum. Filum terminale internum, filum terminale externum. Whole length 20 centimeter divided into upper 15, lower 5. Got it? So that is the extension of pia mater. Filum terminale is an extension of pia mater from the tip of the spinal cord to the level of coccyx. The proximal part of it lies inside the subarachnoid space and is called filum terminale internum, measuring 15 centimeter. The distal part of it lies outside the subarachnoid space, measures 5 centimeter. Is that clear? Filum terminale also gets thickened anteriorly on the spinal cord to form a glistening white colored structure called linea splendens. It gives rise to such projections which are called ligamentum denticulatum. Don't worry, I'm going to teach you this. Okay. So just imagine, see, these white projections are called ligamentum denticulatum. Okay. Now just do this, all of you do this. Sit straight. Okay. Extend your arms like this and imagine that you're holding on to something. Okay. Now will you fall forwards or backwards? No, because you've got this thing to hang on to, right? It's like suppose you're standing on a swing. You hold on to the two rods of the swing, it makes you very steady. But were you to stand on the swing without holding to the two ropes, okay, you're going to fall off, right? That's what the spinal cord does with the help of pia mater. So what the pia mater does is, at every level it gives rise to projections which come out and they get anchored to the dura mater. Dura is tough. Pia just anchors to the dura. Now the whole spinal cord is anchored to the dura with the help of 21 lateral projections. Take a look. All of these are 21 lateral projections of pia mater anchoring themselves to the dura mater. Now your spinal cord cannot move forward and hit against the vertebral column anteriorly or posteriorly. Okay, so this is an important support of your very delicate spinal cord. Suspends the spinal cord within the dura. So that kind of covers the coverings of spinal cord. You saw how it's covered by dura, outside which is epidural space, epidural anesthesia. Then you came in subarachnoid space below the arachnoid mater. Then you came further inside, pia mater, ligamentum, denticulatum. We had a brief discussion on lumbar puncture. Let's now talk about external appearance of spinal cord. What does it really look like? Coverings to kar liya, vertebral column baat kar li, we've talked about it. But spinal cord, that's the topic. What does it look like? Take a look. That's your spinal cord. It shows an posterior median sulcus which extends inside in the form of a posterior median septum. Anteriorly, it shows a deep fissure. There's a sulcus behind. Anteriorly, there's a fissure which goes right in. Okay. It has an anterolateral sulcus on both the sides anteriorly and a posterolateral sulcus both the sides posteriorly. Taking origin from anterolateral sulcus and posterior lateral sulcus are rootlets of nerves which finally join to form spinal nerve. Don't worry, I'll teach you this again. So we're just starting it out, okay? So from the anterolateral sulcus and posterolateral sulcus, you have rootlets which are emerging out, joining to form the spinal nerve at each level. Whole thing surrounded by dura, arachnoid and pia. That's what the spinal cord looks like from outside. Right. Now I'm going to go right in and take a section of it. I am continuing to study the spinal cord from outside, but for that I need you to understand the section. So here's your anterior median fissure. See how deep it goes. Here's your posterior median sulcus and septum. Here's your anterolateral sulcus, your posterolateral sulcus. In the center, passing through the spinal cord, is the central canal, surrounding which is the H-shaped grey matter, surrounding which is the white matter. This is the absolute basic. Remember, spinal cord has grey matter in the center and white matter in the surrounding. This is relevant. When you do the rest of CNS, you will find out why I said this. Right. Now, this spinal cord gives attachment to a number of spinal nerves. You know that. Take a look, the same section, a little smaller. Did you see how the spinal nerves came and got attached on both the sides? This is called as the dorsal root of spinal nerve, ventral root of spinal nerve. The dorsal root also shows a thickening called the dorsal root ganglion. This you are seeing on both the sides, okay? And the ventral and dorsal roots are finally uniting to form a spinal nerve, again one seen on both the sides. So this is what you will see in the spinal cord. You will see the spinal cord and then you will see it giving attachment to a number of roots from which finally a spinal nerve will emerge. But is there only one ventral root and one dorsal root for one spinal nerve? No. There are multiple roots coming out. Can you see this? If you look carefully, you can see a number of rootlets emerging. Okay. So anteriorly a number of rootlets emerge, posteriorly a number of rootlets emerge, and they all form one single spinal nerve. Got it? Now question is, What is a spinal segment or a cord segment? That portion of the spinal cord that gives rise to a pair of spinal nerves is called as a spinal segment or neuromere. Do this once again, please. Imagine all these are rootlets for the anterior side, all these are the rootlets for the posterior side. The anterior and posterior or ventral and dorsal rootlets are finally uniting to form a spinal nerve. So that portion of spinal cord that gave rise to these rootlets is called as a spinal segment or a cord segment, also previously called as a neuromere. Since we are in the world of MCQs, remember these words because they're going to put them up in MCQs. Okay, students, this just for your information, my website gives you a lot of MCQs. Please feel free to go and solve them. There's no charge anywhere. I just want you to go study, revise and become educated medicos. Okay, so please go and solve these MCQs. They're there for you. Okay, right. So now, how many spinal nerves? You saw that if the spinal cord seems to be having such segments through which spinal nerves are emerging. How many spinal nerves? 31 spinal nerves. C1 to C8 cervical segments, T1 to T12 thoracic segments, L1 to L5 lumbar segments and S1 to S5 plus coccygeal segments, sacral and coccygeal segments. What is this, ma'am? Again you put up an animal. Madam, there is no way of stopping me from putting up animals in my videos. Why am I doing that? I think they are the beautiful part of our world. Let's cherish every animal. Let's be thankful that we are born in an era when these animals exist. If we continue the way we are going, we might finally run out of animals to support and make our life beautiful. So yes, I have put up a couple of horses there and I have written Cauda equina, meaning to say the tail of a horse. What is this? How does a horse come into discussion on spinal cord? Come, take a look. So as you're seeing that, the spinal cord, okay, gives rise to spinal segments, but it is short. So when at the level of L1, the spinal cord ends, there are still a lot of nerves which have to emerge out of their individual intervertebral foramina. L1, and then there are all those L2, 3, 4, 5, S1, 2, 3, 4, 5, coccygeal. They still have to exit. So what do? They all descend downwards in the vertebral canal and emerge out of their individual intervertebral foramen. So as they descend downwards, they create a bunch of nerves which are called as Cauda equina or the tail of a horse. Okay, now do you understand what a horse is doing on my video? Okay, so a little bit more now. The spinal cord doesn't really look like a tube. It looks like a tube of variable thickness. So I can see here that there is some kind of cervical thickness, some kind of lumbosacral thickness. Can you tell me why? I'm going to take a pause. You also take a pause. Think. Why is there a thickness? See, spinal cord is going to give rise to nerves. When there is more work, more nerves will have to come out. So in the cervical segment, it gives rise to the brachial plexus. In the lumbosacral segment, it gives rise to lumbosacral plexus. So to be able to give that many nerves, the spinal cord thickens, makes space for relevant number of neurons. So there is a cervical thickness for brachial plexus and there is a lumbosacral plexus for which there is a lumbar thickness. I hope you're getting all this, students. So one last thing before we end this video, vertebral segment versus spinal segment. Look at this image carefully. At the level of C1, the nerve is almost horizontal. At the level of T1, you can see that the nerve has to descend a little bit down to emerge out of its intervertebral foramen. At the level of T1, the nerve is descending quite a bit to emerge out of the intervertebral foramen of its relevant vertebra. So there is, and your spinal cord is stopping at L1. Now I have a question for you. Supposing your patient had a vertebral column injury at the level of T12. Okay. What is the spinal cord segment injury inside? Can you see the spinal cord segment? You can't. You have to just have your knowledge to take a judgment. Ki inside, is it T12 that is damaged? Is it T9 what is damaged? Or is it L1 that is damaged? Will it be distal damage or will it be proximal damage? To understand this, this is the table you should know. If the injury is at the level of T12, you will have to add 6 to get the spinal segment injured. So T12, L1, 2, 3, 4, 5, S1. The damage is at the level of S1 in the spinal cord. Have you got this? Please think about it, and I do not wish to repeat it because it becomes very long. The video becomes too long, but just ponder upon it. It's simple mathematics. Okay. So there is a difference between vertebral column injury to spinal cord injury. You have to understand that concept. So finally, what are the structures that protect your spinal cord? It's lying in the vertebral column, obviously the bones protected. It's surrounded by meninges which protect it. From the meninges, the pia mater gives rise to what? Ligamentum denticulatum. It also, then there is the CSF. It's a fluid. So the spinal cord floats. It can't really hit itself anywhere. CSF protects it. It's anchored in place by medulla oblongata above, filum terminale attached to the coccyx below, and the cauda equina nerves which are emerging out. Each is acting like an anchor. Okay. So these are the factors that are serving to protect your spinal cord. A few questions, students. Let's see if you can answer them. Dura mater covering spinal cord fuses with the periosteum of vertebrae. Does it fuse? No. Why not? Because you have epidural space for epidural anesthesia. Remember, we discussed that. In the adult spinal cord, okay, the spinal cord will end at the level of second lumbar vertebra. Yeah, true. Spinal cord cannot be damaged by a lumbar puncture done at the level between T12 and L1. What do you think? Is it the right? Is it correct? Ma'am, it's ending at L1. It's ending at lower border of L1. If you go between T12 and L1, you will still damage the spinal cord. You have to go below the level of L3. Keep your patient's spinal cord safe and tap the CSF. Okay, students? So go through this once more if you feel you have a doubt in your mind. What have we done today? We've done the spinal cord, its surroundings. We've done a little bit about lumbar puncture. We've just briefly touched upon a section of spinal cord, the grey matter, white matter, central canal, and so on. We've discussed vertebral levels, spinal segment levels, and so on. And we are now equipped to dive into the lecture 2, which is internal organization of spinal cord. I almost instruct all of you to watch these lectures, students. Knowing your spinal cord is the only way you're going to know your CNS well. You must know this foundation well to build upon it when you do the brain part of CNS. Alright, students, if you like this lecture, do like and subscribe to my channel. Feel free to share your thoughts. I'm longing to read more comments from you. I need to know how more I can help you. Okay? Remember, the aim of each of these lectures is to ensure that you go forward as a knowledgeable medico. You must know your anatomy, you must know your subject before you touch any patient. That is the aim of these lectures. Alright, so feel free to contact me if you have any doubts. Thank you. I love taking this lecture. I hope you enjoyed it too. Bye.